Very good. Well, Jason is a pastor in parish ministry. Sam is honorably retired in the Presbytery of Utica. So I got up this morning to watch the news, and the first thing I hear about is the triple demic.
How about that?
What in the world is that?
Well, so where we are with COVID, even though numbers are pretty stable, in some cases declining in various parts of the country, that Omicron variant that we've been dealing with has just spawned a couple of new sons of Omicron. So there are three right now. They've started to, I won't say spike because that implies that big jump, but they've started to peak again or increase again in Singapore, which is usually where we start to look for viruses that come across in the winter. They are also starting to increase again in Europe. They are variants or subvariants of Omicron. And of course, we've gone through a series of Omicron variants. So the bivalent vaccine that's out right now is partly the original vaccine, but partly also a vaccine that's been developed against Omicron B4, B5. So the most recent Omicron variants that have been in the United States that were sort of the peak that we had in August. So these are variants that come off of B4 and B5. They do exactly what viruses have done all along and what COVID has done all along. They become increasingly infectious, so they infect even faster, which is hard to believe because we're about at a 10-second infection rate, but they cause less disease. With the number of vaccinated people in the population now or the number of people who've had COVID, we have a certain level of immunity that's beginning to build in the population in the United States. That means that if you get one of these new variants, and there are three of them, you're not likely to develop anything significant. You're likely to get perhaps an exaggerated cold. There are some people who are still getting significant disease from the COVID variants. There are, however, a number of people for whom the vaccines don't work because they're immunocompromised, have an underlying medical condition, can't get the vaccine, don't want to get the vaccine. Those people are still at significant risk of serious disease. And so right now, CDC and World Health are saying we will get another increase over the winter, partly because these things are coming through the cycle, but also because we're about to go back into enclosed spaces. And so they haven't issued masking or distancing requirements again. The Health and Human Services part of the government is now literally creating a public relations campaign to get out the vax, get people vaccinated. The bivalent vaccine is now approved for people 5 and up, so young kids can get it. But honestly, we are still lagging behind in the number of people, particularly the younger generations, that are vaccinated. And so we will see some increases. I actually do need to do another love note on this, which we'll make sure you get copied on. But we haven't changed the requirements for masking or distancing in any of the churches yet. And I think at this point, you all have heard enough from me to say it's a session decision. Look at your local numbers. That COVID Act now is still a viable database. CDC is still a viable database. The thing that makes it difficult now is that a lot of the testing is done at home and therefore not reported. So those numbers are probably less viable than they were when we were in the active epidemic. But you can still look at ICU bed utilization, you can look at vaccination rates, you can look at deaths, but you can also look at transmission rates as best we know it. And if it hits a threshold, most sessions went through a decision tree rubric early on. I say, take that out and dust it off again. If for some reason you're in an area that has that big spike, then you might want to go back to some of those decisions. This is never, ever intended to be a one and done session decision. But I think we will be okay. You guys, I did look, you guys are pretty well vaccinated. I don't know, you are going back into cold season now. And so the same kinds of advice we were given early in the epidemic about don't have circulating air if you can avoid it, preheat the sanctuary, get people in there. You guys all have, North Face and Columbia down coats, wear those if you have to. But if you can avoid circulating air, if you've got sort of an increase in transmission rates, I would basically say that's where you start.
having a look at COVID Act now.
Yeah, so I can pull it up. In New York State, let's see what you get. So you guys are still low up where you are. You've got about 156 weekly new reported cases per 100,000. That's low. You've got less than 9 COVID admissions in the hospital per 100,000, less than 5% patient bed use. And most of you have, let's see, they don't have vaccination rates. If you go a little bit further north, St. Lawrence, Jefferson, Hamilton, then you're at a higher community risk level only because of admissions to hospitals. So that probably means your vaccination rates are less than 60%, which they are. So
Lisa, is that admission rates for COVID?
yes, that's
Okay.
specifically for COVID.
There was an article in our paper yesterday about staffing shortages at hospitals in central New York that was making the capacity a problem.
Yeah, and I would imagine that's true. I mean, in so many service organizations after COVID, particularly healthcare, so many people just left. And it's hard, particularly to replace nurses. I know one of our healthcare consortiums here in Cincinnati, and we have huge healthcare utilization in Cincinnati. We have multiple hospitals, multiple medical groups. One of them so misused their physicians that en masse, large pieces of practice would go from Tri-Health to Mercy or from Christ to someplace else. And so they're all sort of circulating around. But yeah, if you just pull up COVID Act now and look at New York State, you can get a pretty good idea of what's going on. And some of that you can also say is weather related. So the further north you go, there are two factors there. You tend to have, other than Rochester, Syracuse, you tend to have small communities with small hospitals. So bed utilization percent is going to get high much faster. That means your risk rate goes up faster just for that one factor. It doesn't necessarily mean there's more COVID in the system. It just means the system is less able to take care of it. If I look at, so I'm looking at some of the other, so let's see this is Essex County. So right against the Vermont border, you have low numbers of weekly cases, relatively high bed utilization. So it's about at 18%, but you're 80% vaccinated. You know, so it's a really gamish of factors that go into say whether you're low or high risk. And you really have to look at what's the factor that's making up that high or low number. For a church, really what you want to look at is transmission rate, is what's the number of cases, weekly new cases that you're getting, and the vaccination rate. And then you do what you did before. You look at your congregation, age, medical condition. If you're like some of my churches where everybody's 85 and older and probably resistant to getting the vaccine, that's a church that I would handle differently than the young church with 30-year-olds and they've all been vaccinated. And so each session, this is so contextual.
Mm-hmm.
Any other county you want me to look up?
I'm just looking at some of our surrounding counties. Jason is in Otsego County.
Yeah. So you're at, let's see.
Lower down there, yeah.
Yeah, you are lower down here. Yeah, you're at low rates, less than 100 per 100,000. Yeah, you've got lots of bed space.
I wonder how much of that is based on, again, what's being reported to hospitals and what's,
right,
you know, all the factors that you just rattled
right
off.
Right, but you're also 70% vaccinated, so you're in pretty good shape there. Yeah, everything around Otsego, north of you is a little bit higher, like Herkimer, but everything south and east and west of you is green.
And if we go to the northernmost boundary in Lewis County, it's high.
Yes.
But
yeah.
56% vaccinated.
Yeah, and that's, again, I don't know what the reporting on vaccination is. I never have been able to get my hands around that to know how valid that is. Because I don't know how. I would assume Walgreens and CVS and the little clinics of the world also report, but I know here in Cincinnati, most of our vaccinations, including the rollout of the bivalent, came through the county public health. And so they were counting every arm that went through. So you have to sort of look at what's the availability. But I do think it'll be interesting to see what the Health and Human Services public health campaign does. That kind of thing did a huge benefit to the population when they were talking about things like cholesterol. So we'll see what it does in this divided era that we live in. But you are, for the most part, you're in pretty good shape right now. So I would just say, have your sessions watch. This is a really good website. This one's an easy one to look at. See what's going on.
We're in the season where people are getting their flu vaccines and shingles vaccines. Is there any reason to be concerned about getting a COVID vaccine at the same time?
None at all. It's just a matter of what your immune system can take. I mean, God gave you two arms, flu in one, COVID in the other.
Most of us have two arms.
Most of us have two arms. Yeah, and World Health and CDC have both now come out and said COVID is likely to be an annual shot, which is what I said from the very beginning. So I think there are still clinical trials going on to find sort of the golden ring vaccine that covers all coronaviruses. I don't know that they will ever get there. It depends on the mutation rate. They've never been able to do it with flu. So I find it hard to believe they're going to do it with COVID. But COVID is so well chemically and genetically characterized that it's much more facile with the mRNA platform to be able to change it quickly. And so they will test it all the time, but we will be able to get updated vaccines much more quickly than we do with anything else. So that, I think, we may get a different COVID vaccine every year.
That would kind of stand to reason.
Yeah, absolutely. But other than that, I mean, it's coming to our shores. There's no question about that. We're going to see an increase in COVID cases. Hopefully we see an increase in vaccination rates as well, particularly with the bivalent. The bivalent does cover the new variants, not perfectly. They do evade it more than B4, B5, but the bivalent does generally cover it. So if you've been vaccinated with the bivalent, then you should be relatively well covered for whatever comes. And I haven't seen variants starting to emerge beyond these three. So I'm sure there will be others, but right now this is what's coming from Singapore through to Europe. So this is what will come both to West Coast and East Coast, because that's where it enters from both sides.
Sam and Michelle and I just returned from Synod Assembly last week. We were in this hotel, and everyone in the assembly was masked, but there were like 42 other groups meeting in the hotel that were running around not masked. So.
Yep.
Well, I thought about that last weekend, Lisa, and your observation that it takes about 15 seconds to get infected. And I thought, well, we're sitting out here in the eating area with our masks off for close to an hour, sitting in the hotel. So I wonder what use it was to be masked during the meeting when we're only in a room with us.
Right.
And they were in a public space unmasked.
Right. Yeah, and it's a valid question. I mean, the longer you stay together with any one person, the longer there's a possibility of transfection. However, of the five of us, if the five of us have been with 10 other people today and we aren't masked, we've each been with 50 people, because that's how quick the transmission is. So yes, it's a valid question. I can tell you, Larry knows this, I just came back from my first vacation in 4 years. I went to Slovenia, Croatia, and Montenegro. Nobody was masked. Nobody was masked on the airplane. Nobody was masked in hotels. Nobody was masked. I didn't do a tour, but nobody was masked in the cities. So and that honestly is a big factor why President Biden said the pandemic is over, because we're behaving as if it is. It's not. but we're behaving as if it is.
Well, and that's been leading me into some of my own personal pondering and curiosity. I agree fully. We're never going to be done with this, and an annual, at the least, vaccination or updated vaccination is probably going to be the norm regardless.
Yeah.
I'm okay with all of that. I'm also one of the ones of whether I'm feeling well, if I'm not feeling well, regardless of the cause, I'll be more likely to mask so that I don't transmit things as readily.
Right.
But we are still also as a society treating this somewhat as this is a special thing and not a commonplace thing.
Right.
And you're absolutely right. In some ways, we're moving past that, whether we should be or not, is a
Right.
related but separate conversation. But in terms of if you test negative, 5 days isolation or quarantine, another 5 days of heightened protective practices after that. We don't apply that for any other
Right.
illness that goes around on the regular. So do you have any sense, are you hearing any sense of when that kind of switchover might take place? I certainly don't want to overwhelm our healthcare systems.
Right.
I don't want our nurses and doctors to be burned out, although they already are.
Right.
But when does that turnover?
It's a really interesting question because it can turn over either way when you think about it. It could turn over to, we've learned that masks and distancing work from aerosolized transmissional diseases, colds, flu. Somebody the other day, I was in a meeting last night at a session, and there was an older woman there who was masked, and she said, I don't have any allergies this year. I'm like, absolutely. Pollen is way, way, way bigger than a virus. And if the mask that you're wearing prevents you from getting a virus, it's definitely going to prevent the pollen from getting through. It's universally now understood that the masks do work. So it could go either way. Either as a society, we say, hey, I've got a cold, I should mask up. Or, yeah, we're all vaccinated and COVID's an endemic thing. And it's a little bit like the flu. So if I get a vaccine, sometimes I may get symptoms, but I don't need to mask because it's not that big a deal. I think what has changed, and this is a Lisa-ism, what has probably shifted most in society is that the initial wave of death and severe disease that happened with COVID isn't seen as much now, and it's not as public. So the media is not crazy with it. It's still happening. It's still happening in those people who have underlying medical conditions or are immunocompromised in some way or can't get a vaccine or choose not to get a vaccine, but it's not publicized the same way. In the same way, the really scary part for me about the vaccine, I mean, death is bad enough, but with permanent heart problems, permanent lung problems, permanent kidney problems, causing diabetes, the cognitive decline that it causes in people who get brain fog or chronic fatigue. There was a study that came out that said you actually lose 10 years of cognitive function in some cases with this disease. And so the cavalier attitude that, oh, it's not that bad, it's just a cold, that might be fine for somebody who is fully boosted and otherwise very healthy, but it's not a guarantee. And it's certainly not an okay position for someone who isn't any of those things. So it's like many things in our society, this one is as much driven by media coverage as anything else. And it's partly why I love when people like you reach out and say, what do we know? So that you can be talking about that with your sessions and your congregants and saying, not only is it not done, if you have any predilection to disease, you really need to be careful. And we as a loving community need to help you through that. And that may mean we go back to masking. It may mean we go back to Zoom for a couple of weeks if there's a spike. And you have to understand that that's done in love. It's not done as a punishment. And that's the message I think that we as a believing community need to put out.
Wow.
Don't you love having a little dark rain cloud come and talk at you?
Let's see, we don't have the sunshine here that apparently Larry does up in Utica, so we've just been kind of overcast anyway.
There you go. So I didn't taint it too much then, is that what you're telling me?
Maybe we should end this call with a bottle of Dom Perignon.
And there you go. Alcohol does kill Dom. Well, as you're going, if numbers change or you have questions, don't hesitate to reach out. I'm here whenever you need me.
Excellent. Thanks again, Lisa, for your generosity.
You are more than welcome, guys. And stay safe.
Let's end with a blessing.
Okay.
Beloved Lord, Almighty God, through the rays of the sun, through the waves of the air, through the all-pervading life in space, purify and revivify me, I pray. Heal my body, heart, and soul. Amen.
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 Thank you, friends. You
Thank
take
you,
care of
Lisa.
yourselves.
Bye now.
Thank you.
Take care.